Good morning and welcome to the Center for Strategic and International Studies. My name is Michelle Struck. I'm the Khosravi Chair in Principled Internationalism, the Director of the Human Rights Initiative, and the Director of the Humanitarian Agenda here. We are delighted to have you here today for an important event on defending the caregivers, the care economy, and gender-based violence. To start us off, we will hear from Representative Jan Schakowsky. She has spent her career in Congress as a staunch advocate for women's and workers' rights. She's the founder and chair of the International Workers' Rights Caucus, as well as a member of the Congressional Labor and Working Families Caucus. She introduced the bipartisan and bicameral International Violence Against Women Act to respond to gender-based violence worldwide.
Hi, it's Congresswoman Jan Schakowsky. I want to thank the Center for Strategic and International Studies for the work that you're doing on gender issues. But I want to tell you, this is a very, very challenging time right now. There are some 700 million women and girls who are victimized because of gender violence. And I think that we're going to have to make a serious campaign to raise this issue, to make life safer. As someone who has worked with older adults, I think that we, especially in caregiving, both for caregivers and people in facilities, need to have special protection. I think that AI can be a problem, that people's likeness can be repeated. I know that it has happened to especially some young women. So this is a very, very challenging moment. I'm so glad that you're doing the work that you're doing, and anything I can do to help or speak out, I'm here for you. Thank you.
Thank you, Representative Schakowsky, both for your warm and insightful comments and for your steadfast leadership on this vital issue. It is my absolute pleasure today to be joined by a very distinguished panel of guests to talk to you about defending the caregivers, the care economy, and gender-based violence. Last November, we hosted an event on the future of the care economy, where we talked about the economic, social, and gender aspects of the global care economy. We talked about the fact that 647 million adults of working age outside the labor force do so due to family care responsibilities. And this number is set to increase. By 2030, an estimated 2.3 billion people globally will be in need of care, including children, individuals with disabilities, and increasingly the elderly, which is an increased, just from 2015, it's increased by 200 million. That is to say that every person in their lifetime needs care, all more than 8 billion people on the planet. But right now, the fact that it's more than 2.3 billion globally, and that many of the workers in this are either unpaid or they're working in informal sectors, which are less regulated, of course, or not regulated at all, this affects the vulnerability for gender-based violence. So in this important topic today, as the world prepares for the 30th anniversary of the Beijing Declaration and Platform for Action, and as we are now in UN Women's 16 Days of Activism Against Gender-Based Violence, we find this to be a critical time to have this discussion. There is both a moral imperative to combat and respond to gender-based violence in the workplace, but beyond that, there is definitely a national security and economic imperative. The US government has had two strategies that affect this: the National Strategy on Gender Equity and Equality, and the US Strategy to Prevent and Respond to Gender-Based Violence Globally. And both of these indicate that it's not only a moral, but a strategic imperative to address these. So it is my pleasure today to kick off this conversation, introduce our speakers, and we hope that you will join us online in our future programs as well. So without further ado, I will introduce our guests. So here in the room with me, I'm delighted to have USAID Deputy Assistant Administrator, Bama Athreya. Bama is the Deputy Assistant Administrator for the Gender Equality and Women's Empowerment Hub and the Inclusive Development Hub in USAID's Bureau for Inclusive Growth, Partnerships, and Innovation. And we are so delighted to have her with us, not only due to her stellar reputation, but her expertise on international labor issues, gender and social inclusion, and business and human rights. She previously worked at the Open Society Foundations and as a senior advisor on gender equity and inclusion to the Lotus Foundation. She also previously worked at USAID as a senior specialist for labor, where she specifically worked on these very same topics, including countering human trafficking and promoting women's economic inclusion. And in addition to that, she has extensively written on labor and gender in U.S. trade policy. She has a board member on many distinguished boards and is a regular contributor to inequality.org. Plus, she has her own podcast that you can listen to on the future of work called The Gig. So I'll let you find that online. But we are absolutely delighted to have you with us today, Dr. Athreya. Then second, I have with me in the room Robin Runge, who is George Washington University at George Washington University Law School, and she is an internationally renowned expert consultant on gender-based violence and harassment in the world of work. She also serves on the faculty of the George Washington University Law School as a distinguished professorial lecturer in law teaching domestic violence law and directing the Workers' Rights Division of the Access to Justice Clinic. And very excitingly, I hope you will find her book. She's the co-author of the book Stopping Gender-Based Violence in the World of Work, which very relatedly describes the landmark global campaign that led to the adoption of the International Labor Organization Convention 190, which was the first ever binding international treaty to eliminate violence and harassment in the world of work. She also was the co-director of Equality and Inclusion Department at the Solidarity Center and the director of Enforcement Policy and Procedures in the Wage and Hour Division at the U.S. Department of Labor. Thank you so much for being here. And then last but not least, I have on the screen, joining us from Geneva, Switzerland, Chidi King, who is the ILO's branch chief for gender, equality, diversity, and inclusion. And in this is part of the Conditions of Work and Equality Department. This branch uses an integrated and intersectional approach to strive for the elimination of discrimination, including discrimination based on gender, race, ethnicity, indigenous status, disability, and HIV. And before joining the ILO, she was the director of the Equality Department at the International Trade Union Confederation, where she led work with trade unions on pay equity, the care economy, gender-based violence, and harassment at work. And she also worked for Public Services International and as an employment rights officer for the Trade Union Congress of the UK. So a distinguished panel. I know I've spent a lot of time in your bios, but I want our audience to understand exactly who they're hearing from. So thank you so much for joining us today. So I will start now with a question for Chidi. This is such a critical topic, and the ILO has created landmark conventions that were addressing rights of domestic workers and rights in the workplace. How has the ILO sought to address gender-based violence and harassment? And how do you view, what do you view your chief strategies to address these issues?
Hi, Michelle. Thank you for the question, and I'll say hi to Bama and Robin as well. As mentioned, delighted to be in this panel with them. If I can go back a little bit and look at the way the ILO was addressing issues of violence and harassment, and particularly gender-based violence and harassment in the world of work prior to the adoption of C190 in 2019. I would say that it was there. It was there in our body of standards, particularly, for instance, in relation to the Domestic Workers Convention that you mentioned, which was adopted back in 2011, Convention 189. It was there in relation to the recommendation concerning the transition from the informal to the formal economy. It was there in some sectoral standards. It was there in some policy documents and guidance frameworks, in particular in relation to the healthcare workforce, for instance. So I hope you see from what I'm saying is that it was there, but it was addressed in a sort of piecemeal and perhaps fragmented way. And really did not give very clear guidance to ILO's constituents and broader stakeholders as to what violence and harassment, including gender-based violence and harassment, is, what it looks like, how it manifests, and very importantly, the actions that can be taken in order to prevent and address and redress violence and harassment. So when Convention 190 was negotiated by the ILO's tripartite constituents and adopted in 2019, which was also the ILO's centennial conference, it really was the first time that we had seen an international labor standard that really addressed the issue of violence and harassment, including gender-based violence and harassment, in a comprehensive and an integrated manner. that gave guidance as to how violence and harassment manifests, as to who should be protected from the violence and harassment, which is pretty much everybody connected to the world of work, gave guidance as to the sectors that are particularly exposed to violence and harassment, and how and what should be done in relation to those sectors. It gave guidance as to workplace policies that employers might put into place to prevent and address violence and harassment. And it really brought together two worlds, very importantly, the world of equality and non-discrimination and human rights, along with the world of occupational safety and health, and particularly this prevention aspect of violence and harassment. It gave very clear guidance to our constituents, to governments, employers, and workers as to what their respective roles in dealing and addressing, preventing gender-based violence and harassment could be. If I could move on to how we are working on the topic, we take from multiple strands. So right after the adoption of the convention in 2019, our governing body mandated the office, told the office to adopt a global strategy to promote ratification of the convention, of course, but also to help constituents really put in place the practical measures, both legal and policy, awareness-raising measures that could help to put an end to the scourge of violence and harassment, including gender-based violence and harassment. So we developed a global campaign, which includes tools, guidance. We've developed a whole body of research, including looking at what works in relation to OSH management systems for the prevention of violence and harassment, helping workers and employers develop risk assessment measures to the prevention of violence and harassment, for instance. We have engaged with governments wishing to work towards ratification of C190, sometimes providing gaps analyses, which is really looking at how their legislation addresses violence and harassment and what needs to be done in order to give effect to the conventions. And partnerships, of course, is a big part of that. So partnerships with other UN agencies, but I'd also like to mention Empower, of course, the US-led initiative, which has really provided a very strategic space, actually, for bringing together governments, workers, and other stakeholders to really look at how we jointly, address this issue of gender-based violence and harassment. Much more I could say on that, but let me perhaps pause there.
Thank you. And thank you so much. And thank you for kicking us off with that. It's so gratifying to hear the way that approach was then codified into something more comprehensive and brought those two worlds together. And I know that practical guidance is so essential for governments. I'll turn to Robin. I wanted to ask you, as we think about this problem, I know there's sort of a myth that gender-based violence often occurs in private, when in reality the private and public spheres are deeply connected. And particularly on this issue with GBV amongst the population that is working in the care economy, they're often working in private homes. And in those environments, whether they be homes or other settings, those caregivers, of which they are disproportionately women. I believe the ILO said that it's about 76% of domestic workers, so 3/4 of the 75.6 million domestic workers worldwide are women. That really, I think, amplifies the vulnerability that they have by being in that private setting when a workplace is already a place, and I know many women can personally attest to this, even in the United States, where one is just more vulnerable to being harassed or to experience gender-based violence of various kinds, which can include, for our audience watching, everything from financial abuse to abuse of power to harassment. There's many ways that can kind of manifest itself at home and at work. And so I wanted to ask you, given the gender balance of caring professionals in homes, can you talk about what you're seeing in this area? And how is combating GBV in the care economy different than those that are thinking about combating gender-based violence writ large?
Yeah, so I just want to pick up from Chidi and also say that she was one of the 3 co-authors of the book that you mentioned in my bio.
Oh my goodness.
So credit where credit is due. Picking up from what Chidi was speaking about, what is remarkable about Convention 190, and we are celebrating the 5th year anniversary of its adoption by the ILO right now. It's been a magical year. 45 countries have ratified it. It's the fastest, as I understand it, Chidi, the fastest ratified convention by the ILO, which is a testament actually to the leadership of women workers. And I want to lift up in particular women domestic workers and informal workers from the Global South. They led a multi-year campaign for a global binding labor convention, the first ever to address gender-based violence and harassment in the world of work. And they did that by bringing their stories forward of their experiences with gender-based violence and harassment throughout the world of work. And I want to lift that up because their experiences are reflected in this document as a result of their incredible advocacy. And just for folks who don't know, the ILO is an extraordinarily unique space. It's the only place in the world where employers, governments, and workers come together to mutually negotiate standards that they all abide by, that recognize their mutual responsibility and requirements to make sure that we have workplaces that are safe and provide decent opportunities for economic security. And so these amazing women that I had the privilege of meeting some of really recognized among themselves that they had, unfortunately, this shared experience, regardless of the sector they were working in. And again, I want to lift up that workers in the care economy, and we really need to be understanding of how we're defining that. And I know the ILO is in a process right now of helping us understand what the care economy looks like, who care workers are, including absolutely domestic workers. But importantly, I think before we talk about how it manifests in the care economy, I want to make sure we know what we're talking about. The convention defines gender-based violence and harassment very specifically as a range of behaviors that are targeted at or impact an individual or group of people based on their gender identity. And it has an intersectional framework. It focuses on the impact on the individual and not so much on intent, which is really important. It recognizes that structures enable these things to happen, as well as individuals. Importantly, it also says that it covers the entire world of work. That language is a direct reflection of the participation of care workers and informal workers throughout the world. They were the ones who educated us and helped us understand that if we were truly going to respect and understand and protect those workers who disproportionately experience these abuses, they need to be recognized. If we limit this to a space like we're sitting today, we're excluding almost 60, studies say over 60% of the workforce that is in the informal economy that can be, as you described, domestic workers working in people's homes and in other capacities. So that's another thing that's important. And it covers all workers, and this is also extremely important. Historically, our laws on a national level actually only cover employees. And that may have much significance to some of the folks listening to us, but it's profound. When you start to look at the definition of who has protections in states, including in the United States and many countries around the world, if you extend those protections only to employees, you're actually mostly extending protections to men, and in the United States, for example, white men and people in the formal economy. And so it covers all workers. Think about the language I'm using here. All workers, regardless of whether or not you're paid through a contract or at all. It actually recognizes, lo and behold, those of us who are caregiving for our loved ones are working, and that has value, and that we just have a right to be free from violence and harassment, including gender-based violence and harassment when we're providing that care. So I just want to start there, because before we even can talk about how it manifests in this economy, and I know Bama has really wonderful expertise in this, and so I'm going to let her dive deeper into that. What we know from working with workers is that there are risk factors for gender-based violence and harassment, and those are highlighted in the convention, and those are particularly present for care workers. Again, domestic workers who work in other people's homes. We know that 25% of the care workers in the world are domestic workers, but I also want to talk about other care workers, right? I want to talk about the different modalities of care and how care is given around the globe. It's also through different forms of informal industries and structures and homes here in the United States, Europe, all over the world. We have people who are taking care of people in group settings, right? So caregiving has a much broader frame, but it's an important thing to understand. So what are the risk factors that we know, and what does it look like? Isolation is a huge one. Working alone, where if you were to scream or to yell or ask for help and no one can hear you because you're in someone else's home or because you're in a space where you're the only person providing that care, okay? That's really a risk factor. Another one is working with other people. I know this sounds simple, but many of us do work where we're not providing services as to customers or to family members, and so we don't understand that risk. That is an enormous risk for violence and harassment, and particularly gender-based violence and harassment. So I'm just picking up those, and there are more because I want to really continue this conversation. But what does it look like? I want to be really clear and direct about the abuses we're talking about so we get comfortable. And my friends both here know that I do this. We have workers and women workers, and I want to be clear, it's gender-based violence and harassment. This covers all workers of all gender identities. That was an extraordinarily important piece of this puzzle for these women workers who came forward, is that we recognize that we disproportionately experience these things because of social and cultural mores that place less value on our lives. But that doesn't mean that anybody doesn't experience, everyone does, unfortunately. So it's a tool of oppression, and thus everyone can be subjected to. So domestic workers have shared with me, they are raped on a regular basis in their jobs, right? They are physically and sexually assaulted. In addition to, and I want to be clear, murdered, right? When we don't actually respond to this, I've heard way too many stories, right, of this going on and on and on, and we give permission to people to continue this behavior. So there's a full spectrum. It starts with name calling, right, and put downs and reminding us what our role is in society is based on gender identity and social constructions, but it escalates. And so this is very severe. I mean, I could bring to you, 20 stories in the last 4 months of domestic workers who have unfortunately been murdered when they have, because it just has continued and no one has done anything about it. Flip side, if you complain, you're at risk for retaliation. So I unfortunately know of cases involving that where people do come forward and they complain, and because you are threatening the power structure. So it's all of those things. And I want to be clear, it's committed by people of all gender identities, right? Myths about this are that only men commit this. That's not true. I've heard from many of the wonderful women I've gotten to know about their struggles at the hands of women who they are either the family members of the people they're caring for or others. So there's a lot of dimensions to this, but we have amazing tools thanks to some of the women here and others in the world. So that's a great start, I think.
Thank you so much. That is extremely important, all of the reminders that you mentioned, and the fact that it does occur everywhere, that the convention covers all workers is really incredible. And that these risk factors lead to the kinds of abuses that you mentioned. And I'm glad you mentioned murder specifically. I know I certainly heard about that when I lived in Egypt, but that doesn't mean it only happens in a country like Egypt. It happens here, happens in Canada. And these are places that no country is immune to this problem. So I want to thank you for all of those comments. And I'll move to Bama. For you, please feel free to weigh in on what either have said so far. But it would be wonderful to hear, how does the U.S. government see this problem? And then after you talk about the problem, it of course is helpful alluding to the idea that there are amazing tools and solutions to address it. What are some of the tools, approaches, and solutions that the U.S. government has used that are successful in combating GBV, especially in the care economy? That's what, but please really go into also your own expertise and what you'd like to say.
Michelle, thank you so much. And I do want to thank CSIS for hosting this discussion today. I was not only pleased to be invited, but it was a good opportunity for me to step back and remember why we have adopted new strategies, why we are advancing new programs. And I'll start with the why, and then I'll go quickly into the what and then the how. But I want to start with the why because we all have short memory, unfortunately, right? Public policy making can tend to have short memories. And that doesn't help us when we think about why we're doing what we're doing today. President Biden came in early 2021 with an extremely strong personal commitment. This was certainly a White House and an administration priority, but also a personal priority to addressing care infrastructure needs in the US and around the world. So, first of all, genuinely gets it. We have a president who gets it and understands that we absolutely must do more to invest in care infrastructure. 2, long-standing commitment to ending gender-based violence. We know that as a senator, President Biden was a champion of the Violence Against Women Act, right? So in both senses, we came in with a very strong mandate to address gender-based violence and to address the care economy. And that gave us some legs towards the what. But let me talk for a minute again about the why, again, so we remember. Why were these day one priorities? Well, we have, in early 2021, the situation and the experience of just beginning to distribute vaccines to combat the COVID pandemic and crisis. What happened? Again, we all have short memories. What happened during the COVID pandemic? Millions of women had to step out of the workforce. Hundreds of millions of women actually had to step out of the global workforce, had to take on unpaid care responsibilities. Girls taken out of schools were in the homes. Many experienced heightened, again, we're talking about, very large numbers of girls that experienced higher levels of gender-based violence because they were in the home all the time with the perpetrators of that violence. We also saw lockdowns that affected domestic workers. Robin has just spoken very eloquently about the criminal levels of violence that domestic workers can face. Well, imagine being locked in a home where you are not allowed to leave. You are not allowed to walk out onto the street, even when you are being, abused and harmed. So we saw a crisis of care and at the same time an elevated level of GBV, and at the same time a recognition that care workers are actually essential workers. And Michelle, when you started your comments and talked about the fact that during our lifetimes, everyone needs care. We need care as children. We need care when we get sick, and an awful lot of people were sick, during the height of the COVID pandemic that needed additional care, and someone had to step in and provide that care. And we may need care as we age. If we want to age with dignity, it is very helpful to have supportive communities that provide the kind of care that we may need, right? All of that came into the forefront, during that COVID year, and it became clear that we had to start thinking about care workers as essential workers. Let's not forget, let's not go back to the situation that, again, Robin has described of taking for granted or thinking of, care workers as somehow less worthy of respect than other types of workers. Oh my God, we need care workers. The economy could not continue to hum along without all sorts of care, whether it's unpaid, whether it's volunteered, whether it's paid care work. So, again, I know that I'm sure much of our audience is familiar with this, but it doesn't help to stop and say, let's not take our eyes off the importance of this sector because we don't have a pandemic today, because we could have one tomorrow. And we would want resilient care systems in place the next time around. So let's make sure we're investing in them. The what, Michelle, you began to cover very briefly, and I'm not going to spend a lot of time on it. We came in and immediately put in place a U.S. national strategy on gender equity and equality that talks both about the importance of care and about the importance of addressing GBV. We put in place a U.S. global strategy on preventing and responding to gender-based violence. And I'll name 2 other things. We put in place a women's economic security, a global women's economic security strategy, which elevates as one of 4 pillars the importance of investing in care and lifting up decent work for domestic workers. Okay, so that we enshrined in a economic security strategy as well as a strategy focused on GBV. And then finally, and very recently, we released the U.S. strategy on adolescent girls, which is terrific, and I encourage people who were not yet familiar with it to go and look at it. It, again, really recognizes that we need to invest in ending gender-based violence that affects adolescent girls, in particular ensuring they have access to safe schools. That's an important pillar. And again, coming back to what happened during COVID, we need to have safe schools, because when we don't, we see around the world girls dropping out of school, taking on those unpaid care burdens and being more at risk of experiencing gender-based violence. So that's the what, and I do encourage people to look at where these strategies intersect with each other, because what we now need to do is look at those intersections. Where's the evidence of where there's the Venn diagram between our commitments on care and our commitments on ending gender-based violence? And so here, what we've done is, first of all, invest in better evidence, right? We'd like to know where we are seeing pockets of issues, or clusters of issues that we can address with our investments, right? And I'm coming from USAID, so I think about this in terms of our global development investments. Obviously, nationally, we're looking at this as well, but I will focus on the international and the global development investments. There are some terrific reports that we've had access to and taken advantage of in terms of groups looking at this nexus. The ILO certainly is, a tremendous resource for us. The World Health Organization put out an excellent report last year called Fair Share for Health and Care Work that has a whole section that really does look at that data on gender-based violence in the health and care sector. And I'm going to come back and talk about the health and care sector in a minute if you give me a little more time. And a group called Women in Global Health has put out really excellent reporting, which I recommend, specifically again on gender-based violence and the specific ways it affects women workers in the health and care sectors. Now, I talk about the health and care sectors simultaneously because this comes then to the how. USAID is also, invested in gathering better evidence, and we can share a little bit about that on what we're seeing in terms of pockets and again, or clusters of care workers. And so we do want to break this up into looking at, what are the populations we're looking at that we can affect. And one really important population is community-based healthcare workers. Mm-hmm. When we think about health systems and health system resilience and pandemic prevention, looking around the world, right, who's on the front line of that? It's not hospitals, it's not doctors and nurses. It is around the world, people in communities who are very often volunteers or on small stipends, and they are based in communities, and they are the first line of distribution for primary care services. And they are predominantly women, right? This is a very heavily feminized workforce. It is informal, again, back to what Chidi and Robin were talking about, largely informal. And because they're informal, they don't have, conditions in place around them to ensure they are well protected from harassment, abuse, trauma, even their own health and safety. And these are people who are delivering health services to others in their communities, but we don't have enough protections for their own health and safety. So now we come to the how, and I think I've taken up a lot of time, and we want to get back to the dialogue, so I'm just going to mention one investment that we've made that's really, I think, path-breaking on the how do we help better protect this frontline community care workforce around the world, and I am really pleased to be discussing USAID's first ever direct partnership with a global union federation, Uni Global Union. And we are also partnering with Ford Foundation and with the Care Fund to support Uni Global Union and its affiliates who are working in 5 countries, and I can, I'll name the countries quickly: Ghana, Philippines, Colombia, Dominican Republic, and Brazil. And they are working with these frontline care workers. Some of them are child care workers. In some places, they are community health care workers, community social care workers, and I can talk about that as well. But, really doing the work to ensure that they are enabled to advocate for themselves with local governments, with their communities, with national governments, to have better protections in place for their own health and safety, and to address their right to be free from harassment and gender-based violence. And so to give just one example of that, very recently under this initiative in Ghana, the partner in Ghana is a health workers union. They brought together 800 women workers, representing over 40,000 workers in this sector. And they developed a charter, and the critical elements of the charter that they've developed and are now going to use for national advocacy are ending gender-based violence and getting the government to ratify and implement ILO Convention 190, which Chidi has talked about. Ensuring health and safety standards are in place for, again, the workers that are more precarious and informal in the health sector. Ensuring access to a collective representation, to collective bargaining as a tool to continue to advocate and protect their rights, and investing in leadership training for women leaders within the union. So that's already a lot, and there's just so much more, Michelle, but let's bring it back to the conversation with my wonderful colleagues.
Thank you so much. I think all of those dynamics that you mentioned are so important, from the commitments and strategies and your highlighting of the fact that the intersections of those commitments are really the next space to move things forward, to the specific ways that USAID and the US government have been thinking about these strategic and catalytic investments. I'm also just so impressed, and I always am when we have the ILO as our partner in an event like this, by that tripartite strategy and the fact that you, as USAID, are able to essentially bring that kind of strategy in by investing directly in a trade union like that, and then allowing them, workers, to have that voice that allows them to then push the government. It's really an incredible thing to witness, especially in the countries you mentioned, where I know many of those have more of a decentralized government, and they have more of a kind of lots of capacitated areas in community work and humanitarian aid as well. So that's really interesting. I'm going to go back to Chidi to ask you a little bit about what the ILO is doing moving forward on the 2024 resolution on decent work. But before I do that, I wanted to ask if you wanted to talk a little bit too about the way, kind of why this worker voice is so important in being able to advocate to get governments to have those rights. I know that we're seeing that in practice from the funding that USAID is doing, but I'd love to hear, and I think our audience would benefit from hearing why that's so essential to your model. Oh, and I think you're on mute. I'm so sorry, if you don't mind. Thanks. You still have a sound issue. Let's try one more time. I'm looking at my technician. We can't hear you. I'm so sorry. We might have to move to a different person while we get the sound issue worked out. I'm so sorry.
Michelle, let me come in here for
Sure.
a sec while you're working out the issue, just to build a little bit on the last point I had made about the partnership with Uni Global Union, and to say, I do want to take advantage of this moment as well to say we were also very, very glad to be able to partner with foundations, and that's really important, to partner with other donors on this. And I had mentioned Care Fund and Ford Foundation, but more recently, just a couple of months ago, Avena Foundation and Co-Impact Fund also joined an MOU with us to lift up and ensure we're investing in care workers. And one of the pillars of our MOU is ending gender-based violence against care workers. And so, knowing that, I really want to say we have an open door, and we really think this has got to be a coalition and a set of partners, and we welcome additional partners to reach out to us.
Thank you for that. I'll try your sound one more time. No, I don't know. I do. I'll ask if she should disconnect perhaps and reconnect, or do you think we should wait? Okay. I'll go to Robin while we try again, but Chidi, you might have to try disconnecting and connect again, which I apologize for because it seems to be a sound issue. Thank you. We'll try to get you back. And Robin, I would love to hear if you have any thoughts. I'm sure this rich conversation has probably stimulated a lot of ideas for things you might want to share.
Yeah, no, I think really listening to Bama reminded me to really spend a moment focusing, and your question really wanted me to talk a little bit more about tools. What are the tools we have available? Like, we need, as you said, and this is important, we need to deepen our understanding of what specifically gender-based violence and harassment looks like in different parts of the care economy. So let me unpack what I just said there. So I live and work in the United States. I look like this. I am a lawyer by training. I teach at the law school. I work in a building, right? And I have certain experiences with I don't have a friend who hasn't been sexually harassed at work. I unfortunately have very few friends who have not experienced rape or domestic violence or child abuse in their lifetimes. I just need to unpack that. But how it looks for me, very different, right? Very different. And we need to design interventions where I work that are tailored to how I tell folks I'm experiencing it. And we need to bring in that occupational safety and health lens so that we're mapping our workplaces and understanding the hazards and the risks and defining them so we can prevent. That's our best outcome here, right? It's not building a better mousetrap, right? Which is like the complaint process. We need a complaint process, let me be very clear, but we also need to be looking at institutionally at what we can do to change things. So now let's bring that into the care economy. Let's talk about domestic workers, let's talk about community-based workers. We need to do what I call participatory research. I want to be very clear with a disclaimer now, I am not a researcher. So I am a lay person who has had the privilege of engaging in this process, but most importantly led by the workers that are the experts in their lives and their experiences. They have to be the ones crafting the questions. They have to be the ones conducting the interviews. If we bring external people in to ask the questions, it taints the pot. We understand that. You know, when someone comes in and asks me questions about my safety at work and my experiences with gender-based violence and harassment, I'm going to worry about what are they doing with that? Where is it going? What's in it for me? But if it's a peer, right? And so the International Domestic Workers Federation, for example, has led these issues forever. Adriana, who's the general secretary right now, deeply is committed to and understands these issues, was present at the negotiations in 18 and 19 for C-190. That's why it recognizes the world of work. That's why it recognizes all workers. But now we need to use that tool. It applies to all workers. This is unique. I just need to lift that up again. In most countries, including, frankly, the United States, it's by state by state, and it's changing, and I'm excited about it. But in many countries, domestic workers, as Bama alluded to, have no protections from gender-based violence and harassment. They have no rights to minimum wage and overtime, have no health and safety requirements placed upon the people who hire them to bring them into their homes. So we know those are risk factors. I mean, let me state the painfully obvious. But if you're not recognized as humans who are providing work and care, and you don't have recognized by the laws in your countries, you are at risk, right? But in C-190, though, as countries ratify it, have to include those workers in those protections. But then the rubber meets the road. What do those protections look like? Because again, a structure of prevention, right, whether it be through an occupational safety and health lens, a human rights lens, or an anti-discrimination lens, looks very different for domestic workers than it does for garment workers, than it does for agricultural workers. And we need to break that down. And like I said, Adriana and the International Domestic Workers Federation is right now really engaged and has historically engaged in that process. Research they've already done has shown that over 80% of their members have experienced gender-based violence and harassment and discrimination. But we need to dig deeper because, again, what that looks like, I'll even get more specific. In 2 different homes in Brazil or 2 different homes in Indonesia, right? But there are themes that we can lift there, and we need to listen and have those individual, mostly women, tell us what they need. Another thing that I've learned through listening is that many of these women, care workers, domestic workers in particular, are migrant workers. Mm-hmm. So isolation comes in many forms. It's not just isolation because you work alone in someone else's home or alone in a community. I know that sounds antithetical, but let me pull that out. I'm away from my family. I have migrated from another community to this community because I needed a job and I needed an income to bring back to my family. So now I'm isolated in a whole other way. I don't share a culture. I don't share a language. I don't have possibly status in that country. Risk factor ARAMA, as we say really professionally, right? So C-190 is a tremendous tool because it recognizes these workers. And as we see countries around the world ratifying it, the other is collective bargaining, right? So this phenomenal partnership between USAID and Uniglobal, and I just want to thank Obama for her leadership in that, is tremendous. Through collective action only, I believe, can we see change in this area because of the inequality that exists in these workplaces. Again, using myself as an example, I have enormous privilege. I have never been successfully individually in addressing sexual harassment when I have been targeted. Never. And look at me, like, you don't get much more privilege The only time I've seen that effective is when I have the power to collectively take action, usually through a collective bargaining or a similar mechanism, where I can't be fired for coming forward, and we come forward as a group and assert our rights as a group. Because individually I can be swatted off, I can be fired, I can be let go, I can be killed, But if your entire workforce comes to you, and this is important, your entire workforce, men and women, right? We've seen this globally over the years many times come forward. So those are some tools that I just wanted to highlight more. Hopefully we've got Chidi back so she can pick up the thread.
I think we do. I'll just briefly. Oh, I'm so glad we can hear you now. Yay! Just to recognize what you said before I go back to Chidi, just to thank you for bringing up migrant workers, for bringing up your personal privilege. I know that for me, I think that's a really important part of this conversation. It's also a strange experience. I hope later in the conversation I'll ask a little bit about mental health. But it's just being a woman, even in a very also privileged environment, I find myself in these topics having almost flashbacks to places I've worked and the experiences that other women had as we had the conversation. Like I worked with a group of migrant farm workers when I was in high school, and they used to actually joke about the bathrooms and how that was a site of sexual violence. At the time, I was a teenager. I didn't even really fully understand maybe what my responsibility should have been to do something about that or say something. But it was sort of a part of the culture and economy of what we were experiencing in that workplace.
And weirdly acceptable.
In the United States.
Yeah, and weirdly acceptable as a result.
Exactly.
Right.
And so, and I think your point on the collective voice is so essential, because so much of what the cultural elements of this, the idea of gender-based violence is a kind of a, because of privilege and the tremendous inequalities on the topic and power dynamics, is putting blame back on women or discrediting them. And that happens again in every context where power is challenged and women's voices are, and victims of sexual violence, not only women, their narratives are discredited. So just to say that I wanted to thank you for bringing up those important things, and also just recognize that every single person, because of how pervasive this is, even if we think it's something that employers maybe have discomfort talking about or addressing, or feel they need to give a disclaimer before they talk about it, just because it's not talked about doesn't mean it's not absolutely pervasive in every place. And so I'll go to Chidi, but I'm so glad we can hear you. So please, would love to hear more about the ILO resolution, but also anything else that you'd like to jump in on. And thanks for being so patient.
No, not at all. And I hope I didn't miss too much of the conversation, while I was out. Yes, maybe starting back with another historic moment that happened at the International Labour Conference this year, which was the first time that governments, employers and workers came together to really look at how the care economy shapes our economies and our societies, from the starting point of trying to understand exactly what is the care economy, because it means different things to different people. And I don't think there had ever been a sort of convening, bringing together these stakeholders where this issue had been discussed. So one of the conclusions that we came to is that, well, it's not only, the paid care work that is comprising the care economy, but also unpaid care work. And I wanted to go back to a statistic that you mentioned earlier, Michelle, about the number of workers, of people who are outside of the workforce because of care responsibilities. We've recently updated those figures using a new methodology, and they are just as alarming, even more so. So the most recent global estimates that we have going to 2023 show that we now have 748 million people who want to work but are outside of the labour force because of care responsibilities. And these may range from childcare responsibilities to long-term care responsibilities, including caring for older relatives or caring for relatives with disabilities. Of the 748 million people, 740 are women. Maybe I got those figures wrong. It's 40 million are men, but 708 million are women. So again, it shows you the very strong gender dimension of that and the importance of recognizing and counting unpaid care work to the world of work. But of course, the paid care work force is a large part of that care economy as well. And this is a very heterogeneous workforce. Robin and Bama have very much put an emphasis on the role of domestic workers and community health care workers as part of the paid care workforce, and I really want to thank them for that. Just to say that this is a workforce that ranges from doctors to surgeons and includes indeed community healthcare workers, educators, early childhood and care education workers, for instance, domestic workers, and a whole range of workers whose access to rights, so the enjoyment of those rights, again, might differ according to lines of privilege that Robin also mentioned. So you will have sectors of the paid care workforce, majoritarily women, who are very low paid, who are in precarious working arrangements, who don't have access to the very type of care that they themselves are delivering, that don't have access to labor and social protections that are enjoyed by other workers, and that who are indeed more exposed to risks of violence and harassment. And all of this came up in the discussion that we had in June. The research that the ILO itself has done supports all of this. So we did a global survey a couple of years back, which was the first attempt to look at how people experience violence and harassment, and to really measure those experiences of violence and harassment. And now we're trying really to bring this down to country level data, so to look at, so that we can craft interventions that are actually relevant to specific contexts. We're looking at how we can actually measure experiences of violence and harassment at country level, and really trying to make this gathering of data through act-specific questions to minimize issues around how people understand violence and harassment. And I'll come back to that maybe either in this intervention or a little bit later on. And coming back to the question of the care economy, again, the pilot surveys that we've carried out so far, and it's been in 3 countries in West Africa as part of a project that we've had with France looking at violence and harassment and equal pay. But we've seen in these 3 countries that indeed workers in the health and care sectors report very high levels of violence and harassment. Coming from third parties, primarily, certainly experienced by co-workers, supervisors, etc. But the main comes from patients or relatives of patients.
Yeah.
And if we go back to the pandemic, I think Bama mentioned earlier on, this question of short memories, and I think we really need to learn the lessons that we saw during the pandemic, the vast numbers of women in particular who exited the workforce because of these additional unpaid care responsibilities that fell on their shoulders. But also realizing just how essential, as Bama said, this care workforce is to all of us. I mean, it's not only to our economies and to societies, but to our very existence. And, sometimes I think even now, post-pandemic, we're tending to forget that a little bit again. So we saw how, shutdowns in schools transferred, responsibilities back onto, women who were able to get that support in order to be able to participate in the paid care workforce. And of course, it affected the development of children themselves in terms of, having access to physical presence in schools. We saw the toll it took on an already stretched care workforce in terms of nurses in particular, but also doctors, not having access to the right personal protective equipment, having to make choices if you are on low pay as to whether to be able to shield and keep yourself and your family safe, or whether you actually have to go out and risk contracting, the virus. But then for the rest of us, depending so vitally on, that workforce actually going out and doing its job. We saw the risks of burnout increase. Of course, we saw already extensive working hours increase dramatically during COVID. We saw psychosocial risks, again, increase exponentially during COVID. And we saw, unfortunately, again, healthcare workers being exposed to spikes in violence and harassment, again, from patients, from relatives of patients, from members of the public who were concerned about the transmission of the virus. So, this is a fundamental workforce. Unfortunately, it's a workforce that tends to be highly exposed to violence and harassment, highly exposed to psychosocial risks, which is an area that the ILO is also delving more deeply into, to look at the connection between psychosocial risks and violence and harassment. And it's a workforce that is still, underappreciated, undervalued, underpaid. So recognizing the fundamental principles and rights at work of this workforce is a key first step, and that came out very strongly in the discussion. And then just briefly for our audience to explain what these are. I mean, fundamental principles of rights at work are rights that attach to every worker, no matter where they're working, what sector they're working at, whether they're working in conditions of formality or informality. And they are based on what we call fundamental conventions, or fundamental standards, rather, to be more precise, within the ILO. And these are grouped around, the right to freedom of association and collective bargaining, the right to organize, freedom from child enforced labor, freedom from discrimination, so non-discrimination, and equal pay for work of equal value. And we added most recently what we call our fifth fundamental, which is around occupational safety and health at work. And the ILO is an organization where usually a state's obligations depends on whether or not they have ratified one of the conventions that have been negotiated and adapted. With fundamental conventions, but just by virtue of being a member of the ILO, states have governments have a responsibility to ensure the application of those standards, regardless of whether or not they have ratified them. And it really is, a very powerful tool. The fundamental principles and rights of work framework is a really powerful tool to ensure that workers are able to access and exercise those rights. Of course, at the ILO, we work, in a tripartite setting. So I also want to mention the really crucial role of employers when it comes to dealing with violence and harassment. This is recognized in C190. This is the first time that an ILO convention actually addresses a portion of its text, if I can put it this way, directly to employers. Those conventions are addressed to governments. Governments are the ones who have the obligation, if you like, to engage in the ratification process to ratify, adopt, and implement those conventions. But within C190, there's very specific guidance to employers on the development of workplace policies to address violence and harassment. We'll be working very closely with our employer partners as well, looking at training, developing, a guide and the training materials based on the guide, which enables really employers to really understand what constitutes violence and harassment in the world of work, recognize why employers should tackle violence and harassment in the world of work, importantly assess and manage the risks associated with violence and harassment, identify and uncover cases, develop and implement, policies and procedures that are effective in preventing and addressing violence and harassment in the world of work. So the social dialogue that the ILO always puts forward, that social dialogue between employers and workers, is really crucial to addressing issues of violence and harassment, and especially gender-based violence and harassment across sectors, but again, especially in the health and care sectors. And we'll be doing some work with the WHO in partnership with the World Health Organization next year, which will really examine how violence and harassment manifests in the health and care sectors, and therefore guide us towards taking appropriate measures or effective measures in order to prevent and address violence and harassment in the sectors, I say, which is particularly exposed to the phenomenon.
Well, thank you for that response. And yes, please.
Would you mind if I would love to jump in here and really speak a little more about this dramatic figure that Chidi started her comments with of 748 million individuals that are pulled out of productive economic employment, economically remunerative employment because of this vast care deficit, and coupled with some of the comments on the post-pandemic effect on health workers, to talk about what's next. What do we need to do next, right? Because we can address this problem, and indeed it is incredibly economically suicidal not to address this deficit. Let's just start by looking at what happened post-pandemic to the community healthcare workforce as a result of some of the factors that Chidi has just outlined. The fact that there is harassment and abuse that takes place often, because patients or their families are stressed and take that stress out on these vulnerable care workers. And that results and did result, and we know this from, again, the research that's been done to date in mental health trauma for these workers. And so what did we see? We actually saw, tens of millions of workers dropping out of the critical healthcare workforce, which leaves all of us more vulnerable to not having care when we need it, which in turn results in potentially, or our loved ones not having care, our communities not having care, results in us having to then step in and provide that unpaid care. I mean, the failure to address the deficit that we see in the health sector, and particularly again among these frontline workers, is going to have these negative economic consequences that go on year in and year out if we don't stem it and put in place desirable employment in this sector, right? Which means you've got to, formalize, you've got to put those protections in place, you've got to deal with the fact that health workers themselves need to have their health and safety protected. You need to invest in their mental health care needs, right? If we do that, then that pays us back because we start to address that 748 million number by ensuring that there is a workforce that is stable and rewarded and wants to continue to do the work, as opposed to what we have now, which again is suicidal, because the system we have now is just going to result in more and more workers saying, why should I be doing this? This is stressful, it is not remunerative, and it is affecting my mental health. And so that's a piece of it that we, again, as a global governments, development organizations such as ours need to convene. And this is one of the reasons why, we took on this partnership with UNI. It's not just about worker rights for worker rights' sake, right? I mean, we've been doing that for years. USAID has had a global labor program for years that invests in advancing labor rights in partnership with Solidarity Center. I know, Robin, we worked with you quite a bit when you had that role at Solidarity Center. As an intrinsic good, right? Protecting people's rights, because protecting human rights is a good thing to do. The UNI program isn't that. We're not doing it, we're doing it for selfish reasons. We're doing it because if we don't invest in keeping these workers in their jobs as community healthcare workers, we're going to have much bigger problems to solve down the line in these, care deserts. Similarly, on the child care front, what I do want to say is a good news piece, to Chidi's, again, that dramatic number of 740 million women who are not in paid, activity because of care burdens. The U.S. government worked with other governments to get a commitment to a new G7 target this past year. And the G7 target is to address that care desert, and particularly the child care deserts that we're seeing around the world, with global commitments across the G7 nations to ensure that 200 million more women who are in that, again, in that 700 million number, 200 million more women in the world have reliable, quality, affordable child care available so that they themselves can make decisions about what other forms of paid activity they might like to engage in. So that's for real. That's a real commitment. We have an existing partnership with several of the G7 governments and with several private philanthropies to work with the World Bank on its Investing in Childcare initiative. which is one important tool to address this gap. But I mean, I really do want to say, like, the data was incredibly important, and seeing that number was incredibly important, to our saying, how much of that deficit can we address? Because if we don't, our economies cannot grow. Our economies cannot grow. And why would we want to leave ourselves in a place where we were economically stagnant? So let's make sure that those people who are unable to access paid work, employment or other activity actually have some means to do so.
Yeah, I just want to pick up on this because it's so important to frame this. And Chidi, thank you for starting us on this direction. I really listen to this and I want to raise this point that you've both made, which is that we need to understand that we have, and you pointed this out in their statistics at the beginning, we don't have enough people providing care currently in any way, shape, or form, and we're going to need more of it because of demographics that I don't fully understand, but I keep reading these, and I experience it myself, right? We need more workers, and why don't we? Well, let's pause for a moment and do a snapshot again of who is in the care economy. And again, this is an evolving conversation, which is extremely important. I just need to flag that for everybody. Get engaged in this conversation. Are teachers caregivers? Probably, right?
Mm-hmm.
Let's think about this really carefully for a moment about who we're talking about. So I am literally talking about, right, as I've mentioned, domestic workers. I'm talking about parents. I'm talking about relatives. I'm talking about community workers, all the way up to people, nurses, and teachers. What do all those people I've just named have in common, mostly? They're women, and they're women, they're immigrants, they're migrant workers, they're women of color, they're minorities in the cultures and societies in which they are functioning. They are oppressed, they experience multiple forms of discrimination and harassment. There's a reason why those are unsafe jobs. They are unsafe jobs. Mass quantities of gender-based violence and harassment, which is the focus of our conversation here, which is a form of an occupational safety and health issue, but they don't pay enough to live. And they are excluded often from what we call globally social protections, domestically Social Security or unemployment insurance benefits. Who wants to take those jobs? Okay, so I just need to put this out there. We have to really think carefully about this. If we want to make sure, right, that we have the care economy that we need and the supports. And by the way, these are like the content of the work itself is so amazing. Let's just pause for a minute. It's some of the most, if not the most important work there is in the world. And so many people are drawn to this as a profession because of the want to give and care for others. Like, just pause. So it's not that's preventing people from going into this work. They are dangerous. I talk to women all the time and say, I can't recruit my sisters and brothers into this economy, into this work. It's unsafe. I don't want to set the people up for failure. I don't want my friend to get raped on the job. Think about what I'm saying out loud. So unless and until, right, we're able to really engage the tools we have, and you've heard from all three of us, there are phenomenal tools available. Unless we engage the tools that we have. And when I say we, I mean truly we, governments, employers, workers working together to create solutions that are tailored to the needs. We are going to continue to struggle, right, to encourage and increase this workforce in the ways that we need to in order to support our economies from that perspective, but also to make sure that this is the work that it is dignified work. We don't value it as such. We have cultural and social structures that have devalued it, but we have to really get to the root causes of that. It's sexism. It's racist. I mean, really, right? Xenophobia have all come together in this place. And we have a history globally and domestically of slavery, right? These are all things that are feeding into the manifestations of what the care economy looks like today. And I've watched this for years and really studied this and thought to myself, oh, well, maybe the issue is occupational segregation, right? Maybe if we can get more men into these positions, it will change that. The jobs will become safer. The jobs will pay more, right? The jobs will be better income producing positions. We actually find statistically that's not the case, right? So we're trying to understand a little bit more, right, about what are the ingredients that have led us to this place, root causes, and create solutions. But preventing and addressing gender-based violence and harassment can't happen in a vacuum. We have to raise wages. We have to increase access to social protections. We call this globally formalization of the workforce by recognizing these individuals who are providing this care. And again, I mean that for the full spectrum, right? to the person who is providing care to their grandmother, right, or their neighbor's friend, right, or their community member, all the way up to our nurses who have, multiple formal degrees and yet still actually can't afford to do anything beyond get up and go to work every day. Their housing is unstable. Also, but I hadn't even get into this. The structure of this work is completely, you mentioned this, precarious. Have you ever talked to, like nurses or doctors? I just listened to the radio this morning on the way here. The doctors at one of the biggest medical systems in the country today are going to go on strike on December 17th if something doesn't change. Wow. And you know what they listed as their demands? Social sexual protections. These are people who are suicidal because of stress, right? They've experienced harassment based on gender identity. Right, so the theme, it truly is really powerful when we stop and think about its impact. And I don't want to panic anyone, because the good news is we have tools and systems. The ILO is doing tremendous work to really help us understand how to utilize these international global treaties, and they are tangible. People hear me say that sometimes, they're like, what is that? And then you hear Obama describe how you see that manifest, right, in the G7 agreement, right, and the agreement she has with Uniglobal. These are manifestations of that, because they're reflecting what the ILO's Convention 190, and I want to mention also Convention 189, which preceded it and really helped us understand the needs of domestic workers and informal workers.
These are such powerful messages: the economic imperative, the moral imperative, the nature of the work, I think just the idea that we haven't used the phrase public health crisis, but it's very clear that this issue constitutes a public health crisis in many areas. I think as we start to get into the kind of closing part of this panel, I wish we could go into more detail on so many things that you've said here, from the specifics of the childcare crisis and what the G7 is doing, to the definition of the care economy and then to define it, to what data is needed. But I think what it might be helpful to do as we go around, to let each of you have a full couple minutes to think about your closing remarks to the audience. What do you think, if you could, I know it's hard to choose one thing in what you want to prioritize, but one message for our audience to take away of like one solution or next step that you would prioritize, what would be that moment? And of course, you can also take the opportunity to comment on other things, because we do have a good 15 minutes, so like you could each take about 5 minutes. But really, what would be that key message? I know for me, I've also been reflecting on this conversation in the fact that there's so much interconnectedness in it, and the systematic devaluation of both the jobs and the people, and just the assumptions that our work, our economies will continue to function with this as an invisible undercurrent is just really unacceptable today. That's becoming very clear. It's unacceptable to workers. It's unacceptable to younger workers that are entering the workforce, to people that are struggling between generations of providing care while working. I can see all of that. But the idea, too, that those who are victims of domestic violence, and as you can see from, or intimate partner violence from the statistics here, that so many people are that are in the workforce, they're experiencing GBV, are then, it's a cycle where they're then affected at work, or they're affected in terms of their ability to seek employment. I was reading a study that was done by Women Act in Canada, that was funded by Women and Gender Equality Canada, where they were talking about the fact that specifically when women were trying to, who had experienced intimate partner violence, were trying to seek work, they were actually being physically restrained from seeking employment by not being allowed to leave the home, or being told that their care duties, like you were talking about, their care duties were so substantial that they shouldn't seek work. So their partner or ex-partner were actually sabotaging their efforts to seek work. And then when they did get employment, paid employment, at least outside the home, were threatening to harm their coworkers in 15% of cases, were harassing them at work. Some of them reported, 53% of them reported they lost at least one job due to harassment in the workplace. So there's so much here about the interconnectedness of what happens, both the idea we've had in this conversation, a theme of preventing gender-based violence and the duties that governments and employers and that unions and others have to be able to try to prevent it, but then the other side of addressing it. But I think also just to link to the interconnectedness is important. So I'll go around the room. I'll start at the table, and then I'm going to go to Chidi last. But just to ask you, when you think of these topics, what would you prioritize as solution? And then, of course, any closing remarks that you want to make to leave our audience with. So, Robin, you look very eager.
No,
I'll
I'm
start
very
with
eager
Robin.
because, as TD and Bob both know, my background is in the anti-domestic violence work. I started this work volunteering in what we used to call battered women's shelters. I've worked on these issues for years, and something that I can't believe I've admitted this far, and Chidi particularly probably is shocked that I haven't mentioned it yet, is that Convention 190 specifically addresses what you've just mentioned. So let's back out for a minute. We've mentioned it, but we need to just highlight it again. Unfortunately, gender-based violence and harassment is not limited to any part of the world, of our experience and lives, right? So my personal life experience and that of the people that I've had the privilege to work with is that it is prevalent in homes, unfortunately. And then when I walk to work and I wait for the bus and I get on the bus or I go to the grocery store, I am experiencing forms of this based on my gender identity. And I hate to break the news to young ladies in the audience, but I thought it was because of what I look like. And I thought when I got old and larger that people would leave me alone. Hate to break the news, okay? Because it actually has nothing to do with what I look like. It has to do with what I represent. This is about power and control and reminding me about my role in society, okay? And then I get to work or I get to school and I experience it there. Convention 190, because it was led by women workers. And I want to lift this up. Women workers, primarily from the Global South, women of color, domestic workers. They said if we're going to address gender-based violence and harassment in the world of work, it has to include the impact of domestic violence in the world of work. It expressly does that. So I just want to lift that up. This is how we do this. We stop separating this. We have to see a continuum and address it as a continuum. We cannot have structures that say, oh, when it happens at work, then this. Oh, when it happens at school, then this. Oh, when it happens on a street corner, then this. And oh, when it happens at work, then this. No. Okay? That's why this unique tripartite structure is so critical, is that these parties to this agreement, and it was overwhelmingly supported at the International Convention in 2019 by governments as well as employers in the worker group, including the United States government who voted in support of it. This is important to note. Is that they all recognized that we all have a duty as well to address the impact of domestic violence in the world of work. What does that look like? Well, we're not going to fire someone because they're a survivor. We're going to provide job guaranteed paid leave from work, possibly. We're going to provide other supports, and we're seeing that manifested. We had a lot of first-person narratives provided by workers at the negotiations and studies done by the collective by many unions around the world. And the ILO actually had supported some studies done in Thailand and the Philippines. The Canadian Labour Congress has some of the preeminent work on this about understanding it. So there are tools that we know are available. So I just wanted to, when we do closing remarks, really step into this. Because it's a continuum of experiences and the root causes are similar, right? And so we really need to bring those tools and understandings and great work. And this I'll do my closing because then I'll pass it to my sisters. Listen to and be led by the workers we are having the privilege to talk about today. I am not one of them. Let me say that again. Listen to and follow, okay? The workers in the care economy, they know their experiences. We need to listen. We need to understand that and then support them in their leadership. It is happening at the International Domestic Workers Federation, as I mentioned, all around the world. And there are similar amazing efforts underway by unions of teachers, of nurses in Nigeria, in Indonesia, all over the world. I don't know them all, but I've had the privilege to sit and listen. And every time I listen, I learn. And that's why the tools that the ILO is developing are so powerful, is because workers are at that table and are leading that charge, and those workers who disproportionately experience the things we're talking about. And that's how we overcome some of the things you mentioned earlier. They need to not just be believed, they need to be able to lead. And how do you do that? Well, you can get in touch with any one of us, but there are phenomenal organizations around the world. But we need to step to the side or back and provide funding and support for them, as I mentioned, do participatory research so that we understand more deeply what tools they need, how to implement Convention 190 to eliminate gender-based violence and harassment in the world of work. I know it's all forms of violence and harassment, but I'm focusing on the one that is the focus of today's conversation. So please, please take the opportunity, and we all have a responsibility and an opportunity to affect change on this. I think it sounds sometimes so big that we can't, but you've heard from all of us that there are really concrete things that can be done.
Thank you so much. I really appreciate that, and uplifting the way that Convention 190 addressed it is really critical. So thank you so much, and thank you to the ILO, of course, for your research that has been so helpful in kickstarting and allowing governments to be able to understand the data to address gaps. So Bama, I'll leave it to you for your closing thoughts.
Great. I think Robin really covered a lot of ground, so I'll just really pick up on the importance of collective voice and the how do you do it. I mean, you've kind of opened the door to that, Robin, and remind everyone of something that you said earlier. If I am employed and I am harassed in my workplace, I personally may hesitate to speak out because there are negative consequences for me. But if I find out that 5 other people in my workplace have been harassed, and we start talking to each other, and we collectively step forward and say, you know, we all were harassed by the same supervisor. Let's bring this forward together. I feel much safer, and I believe there's a higher likelihood that the perpetrator of that harassment will be held accountable. That's just just so all of us can really say, okay, when we talk about collective voice, like, why is that important? That's why it's important. So, I want to just lean in on a few examples of things that USAID is doing to invest in that and going beyond unions, because I think that's a helpful door to open as well, to say, like, what are the voices we need to hear? We are working with care cooperatives, and we do know that in the child care space, and increasingly again with care for older persons, we're seeing the importance of cooperatives in that space, and that's an important collective set of actors, a set of actors who are working collectively to engage and to support. We're seeing volunteer councils, and it's really interesting that, as I said, sometimes these community care workers are quote unquote volunteers, but they're still part of a system. They're acknowledged as part of a system. And so, for instance, in Colombia, there's some really interesting work to ensure that the people who are providing care in a system, even if they're unpaid, right? Unpaid care providers have a collective space to share experiences and advocate for the things they need to be able to more effectively do what they're doing in their communities. I haven't mentioned other types of professional organizations yet, but we have talked about a span of workers, but one group that we work quite extensively with are social care workers. They're so important. We work around the world with children who have lost parents or caregivers or been displaced because of humanitarian emergencies. The social care workforce is another workforce that is, undervalued, underpaid, and heavily feminized. And we do work with the Global Social Service Workforce Alliance. And I think that's a really important partner to us and to understanding, again, what they need to be more resilient in the work they do. We work with parent councils. Again, parents, and you said this, parents and families are caregivers. Collectively, what kind of support do they need? And importantly, I would be remiss if I didn't mention the importance of working with survivor councils, who have, people, children, women, persons of all genders who have been traumatized and who can bring us direct recommendations for how to prevent violence against others. So I'm going to stop on that, but I think we all need to work with these groups that are collectively representing the people that have the answers, as Robin said. Thank you.
Thank you so much for all of that, and to both of you for centering the people that are experiencing this the most firsthand, understanding that there's many levels of how we have all experienced it, but to really center them, the care workers, the survivor councils, the different elements of that ecosystem that needs to be paid attention to. And I think that's so essential too, because sometimes in development or philanthropic work, there's a reliance on kind of the same types of partners. And so to see USAID broadening that out, thinking really in depth about who are the actors on this is very heartening to hear. So thank you so much for your leadership on that and for the example. So Chidi, I'll let you have the closing words before I thank everyone and close this out. Would love to hear your thoughts.
Thanks. I think maybe it totally would echo everything that's been said by Robin and Bama. But maybe I'll start off looking at it through a very institutional lens, which is what the ILO calls its 5R framework for decent work and care. Because I think this really does bring together these two aspects of our care economy, which comprises so much more. It comprises all the institutions, the funding mechanisms, the social norms, etc. But let me stick to the 5R framework, because it really looks at why we are in such a care crisis at the moment. The fact that care work, both paid and unpaid, tends to be undervalued, that it tends to be largely feminized. So instead of being distributed, across our society and have some equal inequity between women and men, in particular in society, it tends to be highly feminized. It tends to be also unrecognized. So unpaid care, in particular, tends not to be counted in any kind of national system that looks at how economies are performing or how indeed GDP is growing. And I wouldn't move into topics around beyond GDP, but just to say that this is a fundamental problem that we have and that we need to address if we're going to have sustainable, resilient care economies and move out of what we're already in, which is a care crisis. I mean, I think Robin and Bam already mentioned the impact of demographics. So in many parts of the world now we have aging populations. You mentioned in your opening as well, Michelle, the increase in numbers of people who are going to be in need of care. We do not have the care workforce to meet needs and sustain people's rights to care at the moment. So making this sector an attractive sector that can, retain the workforce that it already has, but attract new workers into the workforce is fundamental. And that means looking again at the way that we value care within our economy, making sure that it is recognized for the value that it gives to our societies and economies, and that it's rewarded. And this is part of the 5R framework as well, that it's rewarded according to the value that it has for our societies and economies, so that care workers' remuneration packages recognize that value, and that care workers have the right to representation, so that they have a voice in shaping the terms and conditions of their work, in shaping policies, national care policies, in shaping workforce strategies, future workforce strategies. And again, of course, ensuring that there are consultation mechanisms for those of us who are the care recipients and want to ensure that we have strong, resilient care systems there that will meet our care needs and meet those care needs from a rights-based perspective as well. So bringing those two aspects together in this 5R framework is really how the ILO delivers its work on the ground. And I have to say, making sure that whether it's working, for instance, in relation to care cooperatives, with Barmer says, it's also what the ILO does, whether it's working with governments, as we've done in Brazil, for instance, to develop national care policies and systems, or in Colombia to do the same, making sure that we bring together these aspects, the aspects of the recognition, the redistribution of unpaid care work, and as well with the reward and the representation of paid care workers. And then just on the I recognize we distribute. I think I forgot one of the R's there, but I just wanted to also back to the issue of gender-based violence, because I think in C190 again, there's this recognition of the fact that power dynamics in our societies are very much part of the root causes of gender-based violence. And the way that we look at care in our societies is very much part of what's feeding into that gender dynamic, that women are still seen primarily as the caregivers, and men as the breadwinners. But we don't value this role of caregiving within our societies, whether it's provided by men or women. And therefore, again, looking at it as something that has very little intrinsic value, and therefore those who are performing it have very little power within our societies, feeding into this issue of gender-based violence and harassment and that we see throughout the care economy. So I know we're pretty much at the top of the hour, so I'm going to wrap it up there. But I think making these connections is absolutely essential if we're going to have a care workforce that's fit for now and fit for the future, because it's not only the demographic changes that we're facing, it's the challenges that are going to be faced by climate change that we're seeing already, the fact that, we don't know what new pandemics are going to come down the road, that, we'll see new communicable diseases emerging as a result of climate change. There will be stresses on our systems, on our environment, that will lead to, health issues and lead to an increase in demand for care. And then technology can step in and help to some extent, but this is again a sector that relies heavily on human connection. So technology will not replace our need for care. It can help enhance the work that care workers do if it's introduced in the right way through social dialogue, and that it's introduced in a way that ensures that the technology has integrity, and that is not going to trammel workers' rights but enhance those rights. And that can help support our care economies, but it's not going to replace the need that we have for that human connection and for the workers who deliver that care to us. So, let me stop there. So much more that could be said, but we're probably out of time for that.
Thank you so much to all three of you. Thank you, Chidi. Thank you, Robin. Thank you, Bama. This has been such an inspiring conversation for one that's so focused on such traumatic and difficult issues. I definitely, Chidi, ending with your remarks, that really presented a vision of what I know the ILO is working toward, what USAID is working toward in the US government, and what you are working on and promoting in the world is this idea that it shouldn't be controversial that people should be safe in whatever work they choose to do, that they should have choice in the work that they choose, and that they should be able to have dignified, recognized, valued, rewarded work that aligns and uplifts our economies and helps us be more effective and strategic. So none of that should be bipartisan or controversial, and I hope it isn't, because this is such an important issue moving forward that I know our CSIS Human Rights Initiative would love to continue to work on, to uplift and to support. The resources that all of you mentioned are just really phenomenal. So I want to thank everyone for tuning into this conversation, for joining us here at the Center for Strategic and International Studies. I want to thank those who helped make this event possible. That includes the generous support of the International Labor Organization in Washington, D.C., their office here. Thank you so much for that. Our wonderful CSIS production staff in the Brock studio here, Danish Matani, Eric Raditsky, and I know you have a whole team behind you of people that I could name as well. My staff, Andrew Friedman in the Human Rights Initiative, and Amina Najam-Adine, who is in the Humanitarian Agenda, who also pitched in for some of our advertising for this event. Again, we will hope you will join us again. And I'll just close by saying it's abundantly clear that while there is so much inspiring work being done on this issue, which is a moral imperative, it is a strategic imperative, it's an economic imperative, it's a public health imperative, there is so much more that each of us can do. And I hope ultimately we have the courage to be able to bring voices together and have these conversations out loud. I like the way you said that, Robin, to have these conversations out loud, name the issues that are happening, address them collectively, and really bring the spirit of courage to that. So thank you again. Please share this with your friends and join us again at our next event.